Hey, what's up, everyone? It's Tony Davenport, Kinetic Medical Massage. And look what I'm holding. This is my square pad from my pulse device that I'm about to turn on to do my heart, my lungs, and of course my intestines, kidney, liver, gallbladder, spleen, all those fun things, ribs, costal cartilages, arms, shoulders. We're going to get some pulse as well. But, you know, the center of this thing is going to be more towards the more power of this thing is right here, where it's going to be more on my heart and lungs. Well, why is that important? Well, for one, I'm a heart patient. So I had that unfortunate talk back in 2014. So I have some things to be concerned about, taking care of myself and keeping that. But you know what's good with magnetism on the heart? Aside from helping the body, the blood vessels and the cardiovascular system to vasodilate, to open up for better flow, it also helps break down atherosclerosis or arteriosclerosis to help improve circulation or delivery of blood flow through the vessels. Also, the heart's electrical. Who'd have thought? What's that sinoatrial node, that thing, that little nervous system thing that gets replaced when it fails and it get electrical suitable replacement when it fails when you're older? Well, the sinoatrial node is our pacemaker. It's the nervous system of the heart. So it contracts the heart. And guess what happens when a nerve contracts? It releases a magnetic field. So what does the heart do? Release its own magnetic field with every contraction. What am I doing? Giving it what it needs to do the job. Help it get along. So I'm looking at a study on, or this one is more of an article discussing the heart has a dynamic electrical capacity, and it actually gives me some numbers of how many watts or how much joules and energy. We're talking 115,000 joules on an average 70 kilogram person. So that's a 150-pound person, and I'm twice that. So obviously I'm going to have 220 or 230 damn joules, or 230,000 joules of energy that my heart's going to produce to move my heart through my body. So that's kind of important. What about its ability for other conditions and autoimmune diseases like high blood pressure and kidney disease? Well, I lower my chances because I do have controlled blood pressure. I have not been told I got kidney disease yet, but it couldn't be too far away if you figure that much. But it's pretty far away considering what I'm doing. So there's that part. So heart health, kind of important. Still the number one killer. Number one killer. Fun fact. Not misinformation. Fun fact, cardiovascular disease is the number one killer of all Americans. So, not discrediting none of the others. Cancer is still number two, but I don't have that. So, let me knock on wood and make sure, because there's still that prostate down there. Well, lungs. I am an outdoor cyclist, a lot of cardio, and here I am looking at one magnetic stimulation therapy in patients with COPD. There you go. COPD, chronic obstructive pulmonary disease. Oh yeah, this study in 2018 again is stating that magnetic field therapy is a feasible, well-tolerated, safe therapeutic option for the treatment of motor-related COPD symptoms. Now, two of my patients, or two of my clients, because I'm not a doctor, I'm going to call them patients, call them clients. See, it's a wordplay. Well, two of them, I didn't come here for that. They didn't come here for their asthma. They didn't come here for their COPD. They came for back pain or something else, shoulder or something. I put the pulse on them and I hit the target area, but they also said, hey, I breathe easier. I don't have, I was like, you what? You breathe easier? Well, there you go. Secondary benefit again of my therapies. So the owners of these pulse devices around the nation, around the world, can give their clients secondary benefits. While treating back pain, I'm treating your lungs too. Why is treating lungs important in this time and day? Treating the lungs, treating the lungs, treating the lungs. Hello, hint, hint, knock, knock, stomp, stomp. You know what that is. It's out there. Treating the lungs. And I'm hitting mine hard. So what happens when you pass a magnetic wave through the lungs in COPD or in asthma? You're breaking up calcification. You're breaking up mucus accumulation. You're stimulating immune cells inside the lungs, the macrophages, to do their job. You're stimulating the alveoli to exchange more oxygen at a cellular level. You're stimulating these things at a cellular level. So basically, put every cell type under this pad on my body is getting an uptick in its ability to do its job better. I'm charging my body. So, COPD, heart disease, and other related systemic concerns between the pulmonary system and your cardiovascular system are getting addressed just by simply hugging this pad for as little as 20 minutes a day, or 20 minutes a few times a week. Or I could lay here for an hour. I can take it home and have it sleep on my chest, on my back. So here to tell you, if you're questioning it or if you're wondering, come try it out. Let the results speak loud to you, and you won't be disappointed. Tony Davenport, Kinetic Touch Medical Massage, Marietta Square. Tony at kinetictouchmedical.com is my email, and kinetictouchmedicalmassage.com is the website. Check it out, book an appointment, and I will be talking to you soon.